Welcome back to CTV Morning Live, 9:19 on your Monday morning. It's time for our Ask the Expert. Nick Antea is joining us from the Ottawa Physiotherapy and Sports Clinics, and we'll be taking your questions, your calls, your emails. Send us everything in either by phone, 789-6559, extension 2803, or you can send us a message on our email, on Facebook, on Twitter. We'll be looking to take your questions. An interesting topic today because we're talking vertigo and dizziness. So welcome back to the show.
Thanks.
And this is something I think a lot of people deal with at different times in their life.
Yeah.
And there's ways of being able to deal and cope with it.
Yeah, absolutely. And if you look statistically, this is something I find it amazes me in the clinic how many people don't know that physiotherapy can actually help for this kind of issue. So I'll be treating an ankle and then they'll see me, a couple minutes later doing something really funky a couple beds over and they say, what was that, right?
Mm-hmm.
And then you mentioned, we also treat people with dizziness and vertigo in some spectrum. And then they say, I didn't even know people did that. So, if you look statistically, 50% of people are bound to be affected at one point in their life. It's the #1 reason people go see a physician after the age of 65, right? So
it's for vertigo and dizziness.
For vertigo and dizziness. So it's really prevalent.
Oftentimes you assume that you kind of got an ear imbalance or you're off or you're feeling nauseous and you don't really necessarily think that it's an alignment or things that have to do with your body.
Yeah, I mean there's lots, and this is where we have to be careful. We always work in close ties with your family physician because dizziness is one of those things where you don't really want to mess around. You want to make sure that you have the right diagnosis. So if you have an episode where you start to feel really dizzy, don't come to us first. Go to your family GP. Let's rule out the things that are really sort of, the big red flags, the nasty ones, and then we can take it from there and basically, get you back to where you should be. Okay,
so how would you treat? Can I ask? I'm trying to picture what the treatment would be for something like that.
Yeah, so basically what we do is we deal with what's called the vestibular apparatus. So the vestibular apparatus is basically an organ inside of your inner ear. So this is where our treatment's actually going to come from. So it's an organ we have one inside of each ear, and basically in a nutshell, each of them has 3 canals. So you have one that's sort of vertical along this plane, one that's horizontal, and then one at a 45-degree angle. So it's when that vestibular apparatus starts to be a little funky that bad things can happen, right? So inside of those 3 canals, you have millions of little hairs, and lining the canals themselves or inside the canals, there's a substance almost like honey. So let's say I move my head this way. Mm-hmm. That honey-like substance stimulates all of those little hairs inside of each ear, and it can basically tell my brain where I am in space.
Okay, the fact that you used honey rather than water,
it's because it's more viscous.
Because I was going to say, is it kind of like a slower moving, dripping? Because if you'd said water, I would have just thought it would happen fast. But honey, I see it kind of going.
Yeah, it's a slow moving thing. So it doesn't, you have to understand how sensitive this organ can be, right? So you don't need, if you had water in there, everybody would be on the ground, vomiting. It wouldn't be a very, very, very pretty sight. But yeah, so when you come into the clinic, basically on your assessment, we usually ask that you get somebody else to drive you because it can be quite an intense experience on your first day. But we basically start with lots of questions to get a really good picture right away of what the issue is going to be. And typically once we're done with these questions, before we even start to assess you using all the specific tests, we have a pretty good idea of what the problem actually is. And like I said, if what you're telling me doesn't match up with the vestibular disorder of an inner ear problem, the odds are that I'm not even going to continue ahead with the assessment. We're just going to cancel it. I'm going to refer you. You're going to get some tests, and then you can come back if they rule out all the other stuff.
So are we on a table for the treatments? Are we standing? Is there a progression?
Yeah, so for the tests themselves, we're going to do them in a variety of different positions depending on what the problem might be. We'll get into that a little bit later.
All right.
But we have to start, I can't emphasize enough, and not every physiotherapist does this. This is something that, you have to go to somebody who's had the postgraduate training in order to do this, because in school we learn tiny little bit. But we basically will do tests in sitting, lying down on a bed. And when we get into the tests that are a little bit more provocative, per se, typically we'll try to have a therapist and even sometimes 2 physios in the room just to make sure that we're 100% safe, because, the bad news is when you come into the clinic, we're going to try to aggravate your symptoms to figure out what the problem actually is. So, most people during don't like us that much,
right?
But, you give it 2-3 sessions and you got your life back, they're pretty happy.
It makes a difference. Okay, so coming up in the next segment, we'll break through.
Yeah, we'll try to break down into the different categories that we treat.
Because interesting to see that there's a number of them and you have to do that many testings to find exactly the right, it's fine tuning. I would think when you're talking about that.
You need the right diagnosis.
So we'll continue to bring you more information on the vertigo and dizziness and how Ottawa Physiotherapy and Sports Clinics can help you with that. And if you have any other questions that have to do with physiotherapy or some of the ailments that may be affecting you, give us a call, 789-6559, extension 2803. Send a message via email, ottawa.morning@ctv.ca. Also send something via Twitter and Facebook. We're back with more right after this.